understanding lung collapse. So, lung collapse is, here it is an interchangeable term, atelectasis, collapse or volume loss are interchangeable terms. They sometimes use interchangeably. Atelectasis is a reversible disorder except that caused by contraction atelectasis due to local or generalized fibrotic changes in the lungs or pleura that prevents full expansion of the lung. Collapse due to this pleural fibrosis, that is because of local or generalized fibrotic changes, is irreversible phenomena because that prevents the full expansion of the lung. And pleural effusion, we have to remember, pleural effusion we all know with shift of mediastinum to the same side being an ominous sign. Ominous means it is a very bad sign. Normally what pleural effusion does, with pleural effusion the mediastinum is shift towards the opposite of the side of effusion, but pleural effusion when the shift of mediastinum to the same side is a ominous sign. It means it is grievous and serious condition. So this is the atelectasis. So there are the types of atelectasis we can see here. This is one is resorption atelectasis. What happens in resorption atelectasis? Here we can see there is a endobronchial obstruction, that may be tumor, that may be foreign body, that may be long standing broncholith, sometime inspissated broncholith. So this will cause the distal airway, distal air will be absorbed, and finally this lung will collapse. Here we can see, once we remove this obstruction, this lung will further open up and it will gain its normal function. So this is called resorption collapse. Another is your compression collapse. What happens in compression collapse? There is a compression of lungs because of pleural fluid. Here we can say pleural fluid or air. Pleural fluid happens in long standing empyema, chronic empyema, pleural effusion, large pleural effusion, and in pneumothorax. This causes lungs to collapse, or there is a compression of the lung. What happens once we remove the fluid, we remove the air, ultimately this lungs will open up and compression will improve. Another is contraction atelectasis. What happens in contraction atelectasis? Here we can see, because of long standing pleural disease that leads to fibrosis, focal or diffuse. This will not allow lungs to expand and ultimately lungs get scarred. Fine, here lungs get scarred and it is an irreversible phenomenon. So this will not allow lungs to expand fully. So this is very important to understand that cicatricial is also called fibrotic collapse. Fibrotic or contraction collapse is an irreversible phenomena, and it is a sequelae of long standing pleural or sometimes pericameral disease also. So this is the three types of collapse. One is resorption collapse, another is compression collapse, and third is contraction collapse.